Hi everybody, Dr. Kogan, Medical Director of Center for Integrative Medicine. Today I'm going to show you how to do a home B12 injection. It comes up all the time. It's super easy. You need basic things, and I'll go over what you actually need to have. We recommend it to a lot of our patients, and I felt it's important that you see how you can do it to yourself. I think I have a video somewhere on this channel how to do it to somebody else, but this is the video when you need to do the B12 injection at home. So the B12 comes in different forms. What I have here is a 1 milliliter vial. It's already sterile. It comes with this protection tape that I would simply take off when I'm ready. You may have something that looks exactly like this. You may also have already a syringe that will be pre-filled with B12 from the pharmacy. We often put orders for wellness pharmacy, compounded pharmacy we like to use. And often you would get a syringe that already has the B12. So then drawing the B12 from the bottle into syringe step you can skip and go straight into the injection part. But if you get it like this is what you're going to do. You'll need an alcohol swab for two things. You need to clean your skin, and if this is a multi-use vial that you've used before, you need to use the top of the vial. You want to have some kind of a gauze just so that, if you have a lot of drop, it doesn't stay in your clothing. And the same if you want, it's optional, is to have a little Band-Aid. So for syringes, I recommend that you get 1 milliliter syringe if you're using 1 milliliter volume. I don't actually have it right now, so what I have here is a 3 milliliter syringe and the small needle. So I'm going to, and sometimes syringe will come with a needle already, which would make it a lot easier for you. So you open, and you want to make sure that your hands are clean. Ideally you would use gloves, but it's your own skin, so you don't have to really worry about picking something up from somebody else. So this is your syringe with the needle. You have to take the lid off. This is the vial. I don't need to sterilize the top, but otherwise you would rip off the alcohol pad and clean it. When you're using the glass bottle, it's important you reverse it. So you kind of invert it, put a little bit of air in, and then draw every last bit. You don't want to waste any material. And then you can discard this bottle. After you drew it in, there's one extra step. You want to shake it just a little bit to get the bubbles off, and you want to make sure that there's no air left in the syringe by kind of making sure that a couple of drops, I don't know if you see, there's a couple of drops come up on the tip. So, and then the syringe is ready. I'm going to recap it. Usually we don't ask for recapping because you can poke yourself. I just want to recap it just to show you how I will prepare the skin. You don't have to do that. You can prepare your skin first. So this way you don't have to recap it, so you just don't put it down at all. I like to, for most of my patients, to go into the belly. Why? We all have a little bit of fat here, so you're not going to go into any organs. See how short this needle is? It's less than an inch. No matter how deep you're going to put this needle in, you're not going to hurt yourself. With a small needle like this and with the belly, you also don't have to draw blood to make sure you didn't end up in an artery or kind of a blood vessel. If you're gonna shoot the legs, buttocks, or the tricep, you want to draw back. That's really hard to do when you're by yourself. So with the belly, you open the skin. It doesn't really matter where. You don't want to go straight in the belly button. And you also, if you're doing it a couple times a week, you also don't want to do it in the same exact spot every time. So you would want to do, say, on Monday here, and if you're doing it on Friday on the other side, and then keep rotating. So you want to prep it with just swap of 1 time of alcohol. If your skin, you perceive it dirty, you may want to do it a couple of times, but generally this is considered very safe and very low risk of contamination, so you don't have to do it multiple times. I do recommend you hold your skin between your fingers. Why? When you inject, you want to make sure it goes straight in and that you don't shake, because if you shake, you can just hurt yourself. Otherwise, I don't think there's other risks. So what I'm doing is I'm simply putting needle all the way in, and then I'm gradually injecting. When you're injecting, don't rush, because you may feel a little bit like I'm feeling a mosquito bite like pain. And so if you push it really fast, very hard, you're just going to hurt a little bit more. And I also think it's a little bit better for absorption to inject probably over maybe 30 seconds time. So I'm almost over. When you're done, take that gauze you were preparing, pull the needle out, put the needle down so you don't have to worry about that, and just make sure, just check to see if there's a drop of blood or not. If you're seeing a drop of blood, then you're worried about, like, I'm in a clinic, I don't want to stain my clothing, so I'm gonna just put that little teeny, small band-aid right over. Sometimes now I'm wondering if I even see where I went. I think I went right there, so I'm just gonna put it over. And you're done. Don't forget, don't recap. If you don't have Sharps container, the way to do this twofold. You can recap if you don't have Sharps container. And then you can take this off and put it in the regular garbage. It's generally not recommended. It's best to have some kind of a Sharps container that you can appropriately discard it. This can go in the regular garbage, so is everything else. I hope you liked it. Stay tuned for more videos. Have a good day.